Hi, I'm Chantel. Congratulations on beginning your orthodontic journey with Invisalign. To answer proactively a few questions that might come up during the course of your treatment, we've made this short video, so pay attention. On the day of your Invisalign delivery, you'll be given a paper with Invisalign care instructions. You can refer to that paper or to this video should any questions arise. Starting with the basics. Your Invisalign should be used all day long except for when eating or brushing. The daily goal for hours of wear is 21 to 22 hours a day. At this rate of wear, your trays can be changed out every 7 days. Follow the guide on your Invisalign instruction sheet if your hours of use per day vary from what is recommended. If Dr. Adams or your assistant give you different instructions from these, follow their instructions as they are specifically tailored to your treatment and outcome. As you progress through aligners, it's recommended you save the previous trays in your sequence in case at any time you need to revert back to a previous tray. In addition to that Invisalign care paper, you'll also be given an Invisalign hygiene and toolkit. The things you'll find in that kit are a toothbrush and floss to be used daily and diligently. We recommend brushing at least 2 times every day. 3 times is recommended. You want to keep your teeth clean and free of cavities during your treatment. You'll find in this kit a nail file. This is to be used in the case that any of your trays have sharp edges on the ends of the plastic. Use a nail file to file down those points to make them more comfortable. A molar golf tee. This can help you remove your trays. Invisalign wear instructions. Putting on and taking off the trays will be displayed in a short video here. To place the trays, line the trays up over your teeth and press down firmly using your index finger and your thumb to seat the trays fully. To remove the top tray, start from the lingual or palatal side, and the lower tray begin from the cheek side. Your trays should be worn all the time except for when you eat and brush your teeth. The only time the trays should be removed are to eat and brush, and if you're going to be drinking anything other than water. Before you put the trays back on, you should clean your teeth, preferably brush and floss, and also clean the insides of the trays. Brushing the insides and outsides of the trays is preferred to make sure you're not putting dirty trays on your teeth. Each time you brush your teeth, you should also brush the in and outside of your trays. Gently but firmly. Avoid too much pressure because you don't want to bend or break the tray. Whenever you take the trays out, you should always put them in one of the cases that your assistant and the orthodontist will give you. These cases should be used anytime you remove the trays from your mouth. You will be given 2 cases to keep your aligners in whenever not being worn. Never wrap your trays in a napkin or a paper towel. Because the trays are invisible and clear, they're often mistaken for trash and then thrown away. What not to do with your Invisalign trays? Hey, no. For some reason, pets love to chew up Invisalign trays. So keep them in their cases in a dry, cool area where they'll be safe. During the course of your treatment, the orthodontist might prescribe the use of chewies. Chewies are little rubber reusable rolls that you'll use with the aligners in. You'll get them in your initial delivery hygiene and toolkit. Chewies are used to help seat the aligner against the teeth and prevent and resolve air gaps. Air gaps are little bubbles of air between the insides of the tray and your tooth, where your tooth is not completely tracking within the tray. If your tooth is not completely seated within the tray, that means the tooth hasn't quite moved into the prescribed movement of the trays. If you have any concerns about air gaps, bring up your concerns at your next scheduled appointment, and the orthodontist and assistant will evaluate and make a plan. In the area where you notice the air gap, while wearing the trays, place the chewy and apply constant, steady pressure. This will help seat the trays. This should be done for 15 to 20 minutes a day. In the case of lost or broken aligners, don't worry. There's a solution. For example, you've been wearing tray number 13, but your dog ate it. What you should do in this case, if you have tray number 14 at home with you, skip ahead to tray number 14 if you can wear it comfortably. If you do not happen to have the next tray in the sequence at home with you, revert back to the previous tray in that sequence to hold the position of your teeth until we can order you a replacement tray, or we can have you into the office to deliver the next tray in the sequence that comfortably fits. If you ever forget what tray number you're currently on, there's a handy little trick you can use to get back on track. On the bottom of every tray is displayed a serial number, the Invisalign logo, the tray number you're on, as well as the orientation of that tray, if it's the upper or lower tray, signified by the letter U or L. If you should happen to lose an attachment, don't worry. A lost attachment will be evaluated at your next scheduled appointment by the orthodontist and the assistant. At that appointment, we'll see if that attachment should be rebonded or if it's okay to progress in treatment without it. Should you lose a button, which is the small metal attachment bonded on the teeth for use with elastics, discontinue all elastic wear until you can be seen by the doctor at your next scheduled appointment. There, he will evaluate to rebond the button or continue without elastics. During the course of your treatment, if anything should arise, you have any questions or anything we can help with, we have a dedicated team who's committed to providing you with excellent service and care. Don't hesitate to call.